ACDN, this is Sarah Jackson. I'm filming from Green Cross Vet Sandringham, video 9, standard precautions. First of all, I'm going to talk about hand washing and when we do hand washing. Very important for infection control. So we do our hand washing as soon as we arrive at work, before and after touching any patients, before any aseptic processes like surgery, after handling any bodily fluids, blood, urine, after touching, say, a patient's surroundings when we go into the kennel room or when we're cleaning out the cattery, before and after after removing gloves, and also after we've been touching some instruments, so if we've been clearing up surgery, before and after we use the bathroom, and also before we leave for the day, before we leave on shift. It's Sarah Jackson, Green Cross Vet Sandringham. This is video number 9, standard precautions, and I'm just going to do my hand washing technique. So first of all, I'm going to wet my hands. So make sure my hands are nice and wet. Then I'm going to get some soap from here. So I'll just turn it around so you can see the soap on the wall, which is the Oxybac soap. I've just got that on my hands. Then I'm going to rub my hands into the palm like this. Then I'm going to do this with my right hand over my other hand. Then we're going to do palm to palm like that. So we've done this action, now we're doing that action. Now we're going to kind of scrub and rub, that's what I call here. Then kind of twisting the thumbs, so we get right in there. Then we get our fingers and kind of scrub around like this, like that, and also with our left hand. Then we do rinse our hands with water. I like to flick it off like that, so don't drip too much. Then I'm just going to grab some tissue from the other side. I'll just grab it and show you. Got some paper towel. Dry my hands nice and thoroughly. Then I'm just going to clean the faucet where I've been touching. And my hands are now, I'm going to get rid of this into the waste paper bin. Now my hands are nice and safe and ready to go. Jackson, Green Cross Vet Sandringham, talking about standard precautions in video 9, and we're talking about hand care. So why is it important that I use hand care? Why is it important I use my moisturiser? Well, if you look at some of the different scrubs that we have, like iodine and the hand washing detergents, they're very stringent on your hands. It's very important that you moisturise after you've washed your hands. And one reason for infection control is we don't want our hands to get dry. If our hands get dry, we might have cracks. Infection can get into the cracks, and that's where you're actually harbouring and making yourself as a vessel for infection. Jackson, Green Cross Vet Sandringham, video 9, standard precautions. Just to show you, this is my hand care. I like to use a good amount of cream. Now my hands are protected. I've even got a little bit of a barrier with the extra moisture. No cuts, nothing. And just dry off a little bit because that was a little bit much. Hi, Sarah Jackson, Green Cross Vet Sandringham, standard precautions video. Just to show what I do if I got a scratch or if I got a cut. As you can see, I've simulated a cut on my hand. The puppies just scratch me because they can be a little bit boisterous, they don't mean to. They've got a little bit of a scratch and it's bleeding. So what I would do immediately is I would grab something to stop the bleeding, first of all. So I've grabbed some tissue and I'm going to hold it for 60 seconds. Pretend I've done 60 seconds, so I don't have 60 seconds on this video. And then what I would do immediately is rinse it. I have here an iodine scrub that I would use, which is the best for cuts, getting into it, making sure no germs are in there. And obviously with the cut, I just rinse off the iodine. I would dry my hand, make sure it is as dry as possible, and pretend that there is a cut still there, not red pen. I would then grab myself a band-aid once it was fully dry, and I would place that onto the cut over that little wound, making sure that I'm not letting anything out of there or letting anything into it. Jackson, video 9, standard precautions. One of the things, the requirements is to show where our sterile supply area is. So just to give you an idea, I'll just walk back from it. So this is our sterile supply area that you can see. Everything goes in from this side and is also accessed on the other side into the surgery, so it's completely sterile. So inside we have sterile kits, surgical kits. We have surgical hand towels, forceps, scissors, swabs, sutures. There we go. So everything in here is basically dust free. Goes in here from once it's sterilised from the autoclave, goes straight into here and then goes straight into theatre. That's how it's kept sterile. Obviously we distinguish our kits also from once they are wrapped, they go straight into the autoclave and come straight to there. They don't sit around anywhere else, and they don't collect dust. Videoing from Green Cross Vet Sandringham, and just to talk about sharps removal. So I've just given intramuscular injection to a dog, and this is how I would safely dispose of the sharps. We're lucky we've got this sharps bin, which has a special lid. I basically put the needle in and hook it into, can you see that? Hook it into the sharps bin, hook it right in, then I pull off, and this will release the needle into the bin without having to actually touch the needle. There you go. And that's how to safely remove a needle from the syringe. Thank you for watching. Bye.